You might be wondering how COVID impacts the human body. Hi, I'm Andie, and today I'll be talking about how the different variants of COVID compare, what parts of the body COVID impacts, what are the different effects for different ages, how we reduce the effects on the human body, and what are COVID's after effects. These are 5 different variants of COVID, and here are some of the ways they compare. Alpha was the first variant of COVID and the worst kind because a lot of people had to go to the hospital. It is more intense than the Delta variant, which followed it. Alpha produced worse symptoms than Delta. These included brain fog, very high fever, loss of taste and smell, and difficulty breathing, while Delta symptoms are sore throat, headache, runny nose, and fever. Zeta and SARS are different because SARS is just like a normal cold or flu. An example of its symptoms are fever, runny nose, dry cough, and body pain. Zeta symptoms are fever, sore and or scratchy throat, chills, body aches, and skin irritations. In comparing Omicron with Delta, Omicron has more intense symptoms, but only some of them are worse than Delta. The symptoms of Omicron are sneezing, brain fog, dizziness, fever, and body pain. The COVID impacts some parts of the body, such as the kidneys, brain, and heart. Kidneys remove waste and extra water and help balance blood pressure. Some people with COVID-19 get kidney damage even if they had nothing wrong with their kidneys before. More than 30% of people have developed kidney damage that have COVID. More than 50% of people with COVID need a lot of care for their kidneys. Your heart pumps blood to all of the parts of your body, which gives you the nutrients you need. If COVID impacts your heart, it could make it harder for your heart to pump blood, and it could give you lack of oxygen or heart disease. The brain controls your memory, actions, vision, emotions, breathing, hunger, and motor skills. Some people with COVID experience brain fog. Brain fog is when you take longer to think, you can have trouble sitting in your seat, or you can lose your memory. You can forget how to do things. Some people have to stay in the hospital after they recover from COVID because their brain got affected and they need help with it. As you can see, COVID's impact on the body can be devastating. If it affects your brain, kidneys, and heart, it may change your life forever. There are a lot of effects for COVID, but some of them based on your age. For example, babies 0 to 2 cannot be at very high risk because they don't have the vaccine. But fortunately for them, they don't really get very sick. They can have no symptoms, a cold, nothing that bad. For kids 5 to 17, they usually have flu symptoms or a cold or a cough, nothing that bad. Young adults usually lose their taste and smell. 68% of them do. Some of them regain their taste after 4 weeks. 75 to 80% of them get theirs back after 6 months. Adults 60 and over can have severe health issues and must be treated immediately. The 80 and over age group has had the most fatal results. Unless they get treated right away, with good care, they might need to stay in the hospital, but many do recover. There are ways to reduce the impact on the human body. For example, if you have a cold or a cough, take the medicine that you would usually take for it. There is no real way to make COVID go away. You should also not have too much salt or sugar because that can make you feel worse. Also, if you worry, it can make you feel worse. Not all symptoms can be reduced because if there's not already a medicine for your symptoms, you're not going to be able to reduce your symptoms. Also, reducing your symptoms won't make COVID go away, it will just make you feel better. Some medications that you can take are Tylenol, Motrin, and Advil. People are contagious for 10 days, but after that, they are fine. Also, to reduce the impact, you should not be on a screen too much. It can make you nauseous. You should get a lot of rest and fresh air. The vaccines make it harder for you to get COVID. It might reduce its symptoms, but it might not always work for some people. Some people might be allergic to the vaccine, and some people might just decide to get the first dose but not the second dose, and that might not fully protect them. Other ways to try to prevent getting COVID is to wash your hands with soap and water for at least 20 seconds. You should also wear a mask over your nose and mouth. There are a lot of after effects for COVID, and here are some of them. One example is long COVID. Long COVID is when you don't have COVID anymore, but there is still a little bit left in your body. So you can have a cough, and it can make you very tired. This can last for weeks, months, or even years. You can also have brain fog. It can make you harder to think, and you can have difficulties with other things that you didn't have before. Another example is that you can't get COVID for 3 to 4 months. You can't get COVID from 3 to 4 months because your body knows it makes you sick, so it knows how to fight it off. But it's only from the same variant. You can get a different variant of COVID in those 3 to 4 months, though. A third example is that you could have brain damage. So you can have trouble listening and lose your memory. Overall, you have learned how the different variants of COVID compare, the parts of the body COVID impacts, the symptoms for different ages, how to reduce the disease's impact, and its after effects.